Good day, everyone, and you're welcome to our second section of HLTINF006, which is Apply Basic Principle and Practice of Infection Prevention and Control. Today, we are going to be starting from identifying roles and responsibility in relation to infection prevention and control. As a individual support worker, either we working in aged care or disability, we have different roles and we have different responsibility. However, it's more similar, particularly in health sector. The following are infection prevention approach that most of our companies and organizations are expected to follow. One of them include proper hand hygiene that is consistent with 5 moments of hand hygiene. What are the 5 moments of hand hygiene? One of the 5 moments of hand hygiene is before you start a procedure, after the procedure, before you touch a patient, after you touch a patient, and after you touch the patient's surroundings. Understanding this and knowing that you need to do your proper hand hygiene will keep yourself as well as your client safe. Another thing is appropriate personal protective equipment, that is the appropriate use of PPE. Sometime, of course, when we are thinking of 5 moments of hand hygiene, we might require to use our PPE. Using the right PPE, and after you dispose or you rightly dispose those PPE, of course you are expected to do the proper hand hygiene as well, as in either you use the alcohol base or you wash your hand, depending on the procedure you actually did. Safe use and disposal of sharp items. You do your proper hand hygiene afterwards. Routine environment cleaning required us to also use and do our proper hand hygiene for infection control. Proper reprocessing or reusable medical equipment and instruments. Respiratory hygiene and cough ethics. These are some of the expectations that we are expected to follow when we are talking of infection control in our workplace. Proper aseptic technique, proper waste management, and appropriate handling of linens. These are some of the things that is so important and associated with our role. And whenever we are engaging or whenever we are doing anything in line with all this, all the stated above, we need to have it at the back of our mind to always perform proper hand hygiene. Just as said earlier, workers. So the roles and responsibilities, these are individuals who perform the work in the workplace. They are responsible for both their and others' health, and they must comply with the workplace health and safety policies and procedures at all times. Often they will ask to cooperate and collaborate in creating policies and procedures as well. If you are required to do this, of course, we should provide the necessary feedback and input in order for us to be heard and support our organization as they deem fit. The workers who either visit or come from outside or other people that are likely to be affected or that are likely to be under our role is people that are coming from outside. We should supervise them and encourage them to comply with the workplace policies and procedure and perform the expected hand hygiene or infection control as required by our organization. This include but not limited to wearing of PPE and staying away from any restricted areas. Identify control measures to minimize the risk. To determine which control measure needs to be applied, you must first understand how probable harm will occur or how severe the implication will be. That is, you try to do your risk matrix. Risk matrix is understanding the probability as well as the severity of that particular issue becoming a risk. So risk is made up of two components: likelihood of occurrence and severity of occurrence. The following questions are used to determine the likelihood of occurrence. 1. How frequent do you perform the task? Does performing the task more often increase your chances of harm? Or has it happened before in similar or related situations? Giving the right answers to this question will give you a better understanding of the likelihood of such harm occurring. Here are some of the example of severity clarification include: is it significant? Is it insignificant? If something is a minor injury, then we can categorize them as insignificant. If it's minor casualties that require medical attention, then that means it's a little bit more than insignificant. It becomes a minor. And if it is more than that, with the severity casualties that requires hospital with no long-term effect, then we regard to those as moderate, while the major ones are the ones that actually required someone to stay in the hospital due to damage or even that involve any form of litigation. And severity is something that has legal consequence: termination of contract, loss of life, permanent disability, to mention but few. These are the consequences when it comes to us understanding what are the likelihood and the severity or the consequence of the risk. So as I said earlier, when you are thinking about how do you relate or what is it that you're going to be saying this is high risk or low risk, you need to do what we call the risk matrix. That is, how often does it happen, and if it happens, what is the severity of it? If it is low, what do we need to do? If it is high, what do we need to do? Of course, if it is low, we need to keep observing and making the right report. And if it is high, of course, prompt plan needs to be put in place to avoid any severity or any things getting out of hand. This is how we maintain and this is how we look after ourselves to ensure that the infection control is properly managed in our organization. And when after we've identified and when we have decided on this risk matrix, the next thing is to use what we call hierarchy of control. Hierarchy of control is a control measure that we put in place after understanding whether something is low, high, or medium risk. From what you've identified, then hierarchy of control can come. You can use like 2 or 3 or even 5 of this measure to make sure someone is safe. So the most effective control measure sits at the top, and below is the hierarchy of control. Yeah, just like what we have here in the PowerPoint. The first one at the top is elimination. That is the best thing that we can do. For example, if you you find out that you are sick, maybe you after you have a flu, instead of you coming to work, you decide to stay at home, then that means you will not be transferring or bringing that flu infection into the work area. So that kind of control is totally eliminating the infection to others. While substitution control is, for example, if you are working with a client that is, of course, they had flu as well, but instead of you not working with them totally, you designate one particular client member or one particular staff member to support that particular client. So in other words, you reduce the level of engagement with the staff members and that particular client. You reduce the contact to one person only. So in that situation, you reduce the level of infection that can go around, because of course maybe after the person has gotten flu, you ask them to stay in their room and you allocate a particular client, a particular staff member to support them. You've substitute them sitting in the environment and contaminating others to them only having that particular symptoms, and a particular staff member is supporting them to actually reduce the level of infection that can go out or that can affect others. Engineering control is when you put additional support for isolation. Just as I said earlier, if you get someone to stay in their room, then you've isolated them. So and that's engineering is after them being in their room, you can close that particular door, and anytime you go in there, you use your appropriate PPE and you dispose the PPE indoor before you come out. So whenever you have this closed door around your client, that is engineering control. So administrative control example can be that the particular client that is having flu that you've isolated, you can put in the front of their door that before you go in, you need to use your appropriate PPE. So this type of information that you've provided at the entrance of that particular client, that is what they call administrative control. And the last one but not the least is the PPE that you need to put on before you attend to that particular client. So you can see that only having a client with flu, we've used about 4 different control measures, which is substitution, engineering, administrative, and PPE. That is a lot of control measure can be put in place just to be able to support a client or to be able to mitigate any issue associated with just a single infection control. So understanding what works well for you and what works well for your client is very, very important. So identify the control measure entails deciding the control measure to be used or to respond to that particular hazard. These are the 2 ways to identify hazard control measure. 1, we review the task, the work site, and the associated hazard. Then 2, we come up with the measures that correspond for the hierarchy or that correspond to the hierarchy of control, and we pick a perfect control measure or perfect control options that we believe and we think it's the right one for that particular client at that particular point in time. So when you do your appropriate risk metrics, with your risk metrics, it will give you a clearer picture of what is expected, then how to go about it. Any question? Thank you. So the next thing we are going to be talking about is communicate information relevant to risk management. The risk metrics that we've put in place is part of risk management, and when we are doing this risk management, there's a lot of people that is involved in that we need to, of course, share and inform them about what is going on. For example, as a care worker, as an individual support worker, if someone has a flu, as we've said earlier, of course we need to talk to our supervisor, either the nurses, and we need to talk about it in our meetings with the carers, with the even with the other service, maybe the cleaning service that is in our facility. So all this is the information about what is going on needs to be shared with everybody that is likely to be involved. And once this information is communicated appropriately, everybody will be on the same page and understand what is required of them. Some of the people that can be communicated or that is likely to be involved in health sector communication is the supervisor, the general practitioner, the healthcare professionals, the carers, responsible person, and the responsible authority. All these people will need to be informed of what is exactly going on. What do we mean by a responsible person? It might be their next of kin. What do we mean by a responsible authority? If the next of kin is not the one that has the power of authority over that particular client, we need to update the client that, oh, your loved one, your mom, your dad is having flu or they have COVID, and for the meantime, we'll appreciate if you don't come in. You can of course give them a call. Other than that, you need to update their GP what is going on as well. So the following Lotus compassionate care service policies and procedure can be used as a reference to communicate with other personnel. So you should take immediate action to remove or minimize the risk associated with any hazard. You must notify your supervisor immediately if you cannot control the hazard. Even if you control the hazard, appropriate documentation needs to be done. You must document all hazard identified or reported by your client, visitors, family members, which they cannot eliminate or immediately. All hazard must be documented on the hazard report form, and the hazard report form must be completed and forwarded to supervisor within the prescribed time frame. To communicate effectively with others about infection risk management, here are a few tips. Listen attentively to the person that is reporting, either the client or or their visitors. Speak clearly and get clarification on whatever you are not so sure about. Ask question for effective question in order to buttress your understanding about what they are saying. Thank you guys. This is where we are going to stop for today, and we will be starting our next video from document the risk management strategies. Till then, stay blessed. Thank you.